From across Maryland, Virginia, and the District, this is Washington's 24-hour local news leader. News Channel 8 Live This Morning starts right now.
Actress Christina Applegate's breast cancer was discovered on an MRI, and a big question for women has been, can an MRI do a better job than a mammogram for early detection? Dr. Anu Gupta from Associates in Radiation Oncology joins us live with more. Good morning. Thank you for joining us. So was that a major development outside of the world of medicine that people weren't aware of, or were doctors already looking into this?
We have been looking into the use of breast MRI for a few years now, and initially it started off, as most technology does, in experimental types of settings, but now has become, as we've come to realize that mammography with breast MRI is actually quite useful, it is becoming far more mainstream. A lot of the kinks have been worked out, the images have gotten better, and Christina Applegate's story brought a lot of light, as you mentioned, to the use of breast MRI. Her situation is the classic indication for breast MRI, frankly. She had a family history, and she fell into what we call the high-risk category. So breast MRI, just to be clear for the audience, is not indicated for everyone. Okay? It's designed for women at high risk for breast cancer. And when we mean, what we mean by high risk is women who have families, women who have a genetic predisposition to the development of breast cancer, women who have had radiation treatments to their chest in the past, or women who have had a breast cancer already.
And let's review the ages, even just for mammogram. When should you get a mammogram? And if you have a higher risk, when should you get an MRI?
So routine breast mammography is indicated for most women from starting at the age of 40. Now, individual recommendations for a patient has to be made by their physician, because there are certain reasons women should be getting mammography at earlier ages. For example, family histories, genetic predispositions. So those women start at the age of 35. But for the average woman, it's starting at the age of 40, either annually or every other year.
And certainly before those ages, you're supposed to do self-exams.
Well, you should be doing self-exams at any age, but yes.